Diabetes Connections is brought to you by Inhaled Insulin, Glucose Management in the Moment, by Omnipod. Take Omnipod Dash out for a spin with a no-commitment free 30-day trial. And by Dexcom. Take control of your diabetes and live life to the fullest with Dexcom.
This is Diabetes Connections with Stacey Sims.
This week, a conversation about diabetes beyond numbers. Yes, there are a lot of those. They're very important. But have you ever stopped to think about the mental energy and emotional effort behind those numbers, even if your A1C and time in range are what your doctor wants to see?
And a person's going into the doctor's appointment and an endo is just going, oh, great job, keep it up. And you're done, the appointment's over. And so you're not necessarily expected to fix it, but no one's asking about the emotional toll that doing all of that is taking.
That's Alison Nimlos. She and Sara Adams are therapists who both live with diabetes. They've come together to host a conference all about mental health. We talk about a lot of very common issues and how to start talking about them. This podcast is not intended as medical advice. If you have those kinds of questions, please contact your healthcare provider. Welcome to another week of the show. Always so glad to have you here. You know we aim to educate and inspire about diabetes with a focus on people who use insulin. I am your host, Stacey Sims, and my guests this week are putting on an ambitious and much-needed conference later this month. The Diabetes Plus Mental Health Conference is virtual. It happens May 20th and 21st. There's a lot going on to this conference. Of course, I will link it up. Full disclosure, I am doing a session for these folks. I am really excited to have contributed to this. Now, I mean, it's not a traditional, mental health session, of course, but it is my annual game show. So we're doing Wait, Don't Poke Me, the diabetes game show based on NPR's Wait, Don't Tell Me. I've done this for a couple of years now. If you haven't heard it before, I think it's a lot of fun. We have great contestants and we do diabetes trivia and Bluff the Listener, and it's all diabetes themed. So it's a way to kind of lighten things up. I know in many conferences, there's a lot of heavy and very important information. So I just try to sneak in and make people laugh when I can. So I will link up all the information about the conference and how you can see the game show within it online. There's more information there. And again, it is virtual, so you can join anywhere, but it is coming up quick. So my guests this week are Alison Nimlos. She is a licensed associate marriage and family therapist, a diabetes health coach, and she was diagnosed with type 1 at age 8, more than 25 years ago. She works at Greater Than Coaching and Counseling. Sara Adams was diagnosed as an adult. She was diagnosed with LADA 6 years ago this month, latent autoimmune diabetes in adults. Most of you are familiar with that. If you are not, it can present like type 2 diabetes. It is very often misdiagnosed, but it really resembles more of a kind of slow presenting type 1 diabetes, if that makes sense. We've done some shows on LADA, and I will link up more information because I think it's really important. You really need to be aware because it is so misdiagnosed. But Sara was diagnosed with that 6 years ago. She's a licensed clinical social worker and provides consultation and coaching about mental health through Reframe Diabetes. Quick note, I mentioned this in the Diabetes Connections Facebook group. I've been a mess this month. I guess I'd call them minor health issues. Knock on wood, they seem to be resolving. But about 3 weeks ago, I had to take some medication, and I have had a cascade of reactions culminating in a disgusting allergic reaction centered in my mouth. So if I sound a little funny here in this intro, kind of like I've been at the dentist, I feel like I'm talking through Novocaine. It's so strange. But if you've noticed that, you're not imagining it. And then during the interview, I sound like I have a cold. So I hate bringing you bad audio, especially if it's from my voice. But I think this is a really important issue. So I just wanted to mention it and kind of get it out of the way. Okay, the interview in just a moment. But first, Diabetes Connections is brought to you by Omnipod. And I remember years ago when Benny first started on the Animas insulin pump, an upgrade came out. We had to wait years to be eligible for it because of insurance requirements. How frustrating was that? I am so glad things are changing. For example, the Omnipod Promise takes those worries away. With the Omnipod Promise, you can upgrade to Omnipod 5 as soon as it's available to you and covered by insurance, all for no additional upfront cost. Omnipod is available through the pharmacy, which means you won't be tied to a long-term contract and are free to upgrade at any time. Not to mention, you can pick up your pods right where you pick up your insulin. Go to diabetes-connections.com and click on the Omnipod logo. For full safety risk information and Omnipod Promise terms and conditions, also visit omnipod.com/diabetesconnections. Allison, Sara, welcome to the show. Thanks so much for joining me.
Thanks for having us.
We are so happy to be here.
I'm so interested in this. I'm thrilled that you're doing it. Why don't we just start there? Allison, tell me a little bit about what the Diabetes and Mental Health Conference is all about.
I have been, as you know, we've met at different diabetes conferences over the years. And something that always struck me was the fact that so many of these diabetes conferences try to put mental health into like a single 45-minute session. Mm-hmm. And after a while, I just felt like that's not enough. We need to do more. So I reached out to Sara, who I'd met via the magical world of social media, and we talked about different observations that we'd made in the diabetes community, both online and offline in our own clinical worlds, and decided that we wanted to do a full-length, full-fledged conference solely on the intersection between diabetes and mental health, which is coming up on May 20th and 21st.
Sara, let me ask you, what do you think people will get out of this? When we say diabetes and mental health, it's an ongoing, many days, many hours process. But what do you hope people kind of come to this conference and take away from it?
Allison and I have talked a lot about, there's just the different aspects of mental health within the diabetes community. And I know one big thing that we've talked a lot about is just this normalizing of the idea of mental health as health. I think sometimes mental health, even outside the diabetes community, mental health in general, it's getting better, but there's still some stigmas around mental health has to look a certain way, or it has to look debilitating, or it has to look like really, really kind of when people are in these really tough, stressful, desperate places. And sometimes it can mean that, but sometimes it can mean, and I think often means in the diabetes community, just kind of this day-to-day stuff that people are struggling with, just living with a chronic condition, right? And I think what we're trying to do with the mental health conference is really bridge this gap, so to speak, between diabetes has a lot of focus on physical health. And of course, physical health is important, but overall, there's really not a lot of focus on the mental health aspects of diabetes. So things like burnout and diabetes distress and the relationship with food, like that's a big part of people's everyday life with diabetes. We've got some tracks for both people with diabetes and also diabetes providers and caregivers and support people. So we're really trying to bring people together really with everybody who's impacted by diabetes and all types of diabetes. We have type 1 and type 2 to really listen from people who are licensed professionals, all the people that we have at the conference who are speakers, and we can talk a little bit more about this, but a large number of them have diabetes themselves. They've all been impacted by it in some way, and they're all licensed mental health professionals. So again, we're just really kind of looking to bring some people to this space where we can really, again, kind of normalize and bring mental health into the conversation about diabetes management as a whole.
I'd love to talk to you both separately, or maybe one at a time here, about what your mental health needs were, and I assume still are. But Allison, let me ask you, I mean, this has been a longer journey for you. Was there a moment or two along the way where you said, when you even recognized that there were mental health issues going on with things like burnout or alarm fatigue or stuff like that?
Yeah, I was diagnosed when I was 8 years old. And I think at that point, I don't think I had much conceptualization about what diabetes really meant. I feel like it was this very slow onboarding process for me to really understand what that meant. But certainly as I got older into my teen years, I started to experience more emotions about diabetes, frustrated and angry about it and feeling like I was the only one I really knew. I went to camp, but that was 1 week a year. I didn't necessarily see a ton of people with diabetes, in elementary and middle school. And I met Bill Plonsky, who is like the father of diabetes psychology. When I was either late in high school or early college, I'm not entirely sure how old I was, but that was really the first time that I had my experiences put into words, which I think is like the power of counseling and going and seeing a therapist, is you sort of explain what your daily life and what you're going through, and then somebody reflects it back and goes, oh yeah, it's this, and you're like, oh my gosh, it's a thing. I'm not just making this stuff up. And that was really powerful, seeing that laid out. I didn't become a therapist until my 30s, though. I did a bunch of other different sort of jobs and careers in diabetes in my 20s. But when it came to becoming a therapist, it really was, how do I think I can be the most impactful with people with diabetes, and recognizing mental health is not talked about. It was not really talked about with me. I sort of had to figure that out myself through Bill and like the different professionals that I was exposed to and some of the research that I saw, and sort of cobbling this thing together. And now I think, what Sara and I are observing is this really coming to the forefront of people saying like, diabetes has always been affecting mental health, and we really need to start bringing that into the conversation. And I would say that it's absolutely been my experience. I even remember I was at a training in grad school around cancer and mental health, and the speaker was talking about how they do mental health screenings, or I think that they're adopting a policy of doing mental health screenings at the oncologist. And at that point, I knew Bill better, and I emailed him and said, why aren't we doing this? I don't think anyone has ever asked me about my mental health at any of my endo appointments. And he agreed with me. And so I think that's kind of where we're at. We're sort of, using our personal journeys with diabetes to see all the gaps there are.
I remember the first time I heard Bill Polonsky speak, and it was on a podcast years ago, and then I saw him in person. And it was so eye-opening to me. He's at your conference. I'm so glad that he's speaking. If you haven't heard him before, or even if you had, you can't hear him enough. He is just, I don't know. Sometimes he doesn't even say much. Sometimes he makes the other people around him share. I was at one session with him where he just did a big bitch session. He just had everybody in the room who had diabetes, he gave them permission to complain about it. And by the end of it, it turned into this incredibly positive experience. It was very funny. He's very good.
He is. Every time I talk to him, whether it's kind of casually at conferences or like professionally in like Zoom meetings or whatever, I always feel like I've had like a therapy session. It's just, he's remarkable that way, just talking to him. So yeah, we're really, really excited that he is our main keynote speaker on Saturday morning.
Sara, let me ask you the same question. You were diagnosed at a totally different point in life as an adult. Did mental health kind of come up early or at all in your diabetes diagnosis? Right back to Sara answering my question. But first, Diabetes Connections is brought to you by Afrezza. Since starting this podcast, one of the highest interest topics has been Afrezza Inhalable Insulin. I'm really excited to partner with them to tell you more. Afrezza is an ultra-rapid-acting mealtime insulin. You breathe it in using an oral inhaler, and once inhaled, Afrezza passes quickly through your lungs and enters your bloodstream in less than 1 minute, and may start reducing blood sugars within about 12 minutes. Find out more and see if Afrezza is right for you. Go to diabetes-connections.com and click on the Afrezza logo. Afrezza can cause serious side effects, including sudden lung problems and low potassium, and is not for patients with chronic lung disease, such as asthma or COPD, or for patients allergic to insulin. Tell your doctor if you ever smoked, have ever had kidney or liver problems, a history of lung cancer, or if you are pregnant or breastfeeding. Most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Please see full prescribing information, including boxed warning, medication guide, and instructions for use on afrezza.com/safety. Now, back to Sara, talking about whether mental health came up during her diagnosis.
Yeah, for sure. So I was diagnosed when I was 32. I'm almost 38 now, so I'm entering almost my 6-year anniversary with living with diabetes. So I'm type 1, more specifically LADA. So my onset was very slow. And I think that, to me, in hindsight, really contributes to a lot of what my struggle was, because I could tell there was something going on with my body, but I didn't know what. And I was misdiagnosed multiple times. And I'm somebody who is a go-getter. Like I was living in New York City at the time. I was working 2 jobs. I was working toward my clinical license. So I was already, I was a social worker. I was trying to get my hours in because you have to do these state hours to get clinically licensed. And I was trying to do it quickly. And, it's just these things I was kind of pushing through a lot of my life. And I was very tired all the time. And I was attributing a lot of my fatigue to my lifestyle. I was living in New York City and I had a dog and I was working in 2 boroughs. And, so I just kind of kept normalizing a lot of the symptoms that I was having. So it really went on for almost probably a little over a year. And it got to the point I very close to passed out in the Brooklyn IKEA, and got to the point where somebody said to me, like, you need to go, like, something's wrong with you. Like, and it took that for me, like, I almost needed that validation for somebody to say, for me to be like, yeah, something is wrong with me, right? Like, this is not normal. And, kind of same thing. I finally got diagnosed. And even after the diagnosis, I was never hospitalized. My A1C was 11.1. I was literally same day in and out. They gave me about 11 prescriptions, sent me home, did not teach me how to use insulin. I YouTubed it at my apartment when I got home. And I think that just, I could kind of go on and on, but a lot that was kind of pretty descriptive of a lot of my first year with diabetes. I was, nobody really taught me about the relationship between insulin and exercise. I had multiple very low lows, one that landed me in the emergency room. And again, I just didn't really know what I was trying really hard with the information that I had. And I had to learn very quickly things like asking for what I need and asserting boundaries and telling myself it's okay to stop and take care of myself, and blood sugar needs to be tended to and I can't push through things. And, I think a big thing for me was I lived my life for 32 years without diabetes, and I knew what life looked like that was different. And I was used to living a very spontaneous, like, I can go here when I want and I can eat when I want and I can do this and I can do that. And that was a very hard transition for me. And, I think I kind of took it in stride. And at the same time, I needed a lot more support than I had. Leading back to the question, and I think kind of like why I'm so interested in the mental health part about kind of aspects of diabetes is I quickly realized through my experience how little support and how little focus there is on the mental health side of the condition. And I think as a mental health provider and as clinical social worker, I was very attuned to that and just like, what's going on here? Like, this is not something, I think something needs to be different here. So yeah, I think that's kind of that's a big piece of my experience and ultimately what led me here today and into doing what Allison and I are doing with this conference.
So we're not going to really solve any issues today. I don't want to put you too much on the spot, but I would be curious to get your take on some really common issues that people with diabetes seem to have. So can I throw a couple things your way and just kind of see what you say?
Sure.
Yeah.
All right. Okay. Allison, I'm kind of going back and forth. So Allison, let me go back to you. One of the biggest problems I see, again, I don't live with diabetes, and so this one kind of breaks my heart, is people who feel that they're a burden, right? They don't want to ask for help. They feel like they've already cost their parents enough money. They feel like they cost their spouse too much money. Diabetes is a hard burden, but they don't want to share it sometimes with people who will support them, even though we really do just want to help. How do you have those conversations?
You can't see me because we're not recording this through video, but I'm just like nodding my head emphatically.
I'm nodding over here as well, not to interrupt you, but I'm also nodding.
Yeah, that is something that across the board, I hear from so many people, clients in my office and just social media and just events that I've gone to. I mean, this is like a universal idea. And actually not even with diabetes, but also in the clients with other chronic illnesses that I have worked with. So this is a really, really universal feeling that we should not be a burden. And I think burden can look like a lot of things. I think financial burden is one of them. I think time burden. I think emotional burden, or just inconvenient burden, like, that I have to go and do something and it's interrupting, it's stopping us from doing something, that kind of just like a mental burden, really. And one of the things that I try to help clients sort of start to think about really is one, self-compassion. And we talk about this a lot in our conference. It's a very heavy on the self-compassion because I think it's such an important concept. And one of the ways that looks is by thinking about how do you think about your loved ones if they were going through a situation similar to you, mm-hmm. and then kind of identifying that, naming that, really kind of feeling that, like, how do you feel if you were to think about your husband having diabetes or your friend or, your parent or whomever, if they had diabetes, if they were going through this, what would you want them to tell you, or what would you want them to ask you, or how would you want to support them? And then flipping that around and going, it's not any different. Like, they're experiencing what you just said, that they want to be a part of your life. They love you. They care about you. This is what love and care looks like. And so normalizing some of that, and giving permission. And then also, I think, helping people to understand what self-compassion looks like as like a concept, and then also in practice, because, we can talk about concepts all the live long day, but if you don't know how to actually do something, practice it, you're not going to get very far. So that's also something that we really kind of explore.
And it's funny too, as we talk about these issues, I am thinking about my son in that, he's 17, been diagnosed for more than 15 years, has never had a true mental health consult when it comes to diabetes. We check in all the time, but I'm kind of keeping him in the back of my mind. What about the conception? My son definitely does not have this, so I shouldn't joke about it. But what about the conception, Sara, that at some point I should be a better diabetic, right? I should get this. I should be more, I'm not going to say perfect, but I should be almost perfect. After all these other people on Instagram are. So, shouldn't I, after 6 years or after 30 years, shouldn't I know what I'm doing and have this figured out? There's a lot of guilt, I think, in going to the endo and not having those perfect A1Cs.
Oh, for sure. For sure. And this is actually a topic I'm pretty passionate about because I'm somebody who, I know I explained this a little earlier, but I definitely teeter on that edge of perfectionism. That's just something that's a coping response for me. That's something I just like things organized. I like things neat. That's always been part of me and part of my coping. That's another thing that I kind of fell into with diabetes is I would go to the endo and I would have these really quote unquote good A1Cs, and the doctors would look at me and they'd say, "Oh, you're such a good diabetic and you have such good blood sugars and you have such good this and that." And I was like, something like I had this moment one time where I was thinking to myself, like, my perfectionism's getting enabled by the medical system in this way. And, of course, nobody's doing this with ill will, right? Like it's well-intentioned, but I really like to look at things as like, this is information, right? Like, so if I was here at this day, and I say this to my clients too, if you were here this year and you're here this year, let's look at this. Let's look at the information around this and have a conversation about it and not look at it like a good or a bad or a right or a wrong, but as more of a story or a narrative or data or whatever kind of resonates with that person, and getting us out of that kind of concrete, some of those concrete lenses, because I think they can be pretty detrimental at times.
I'm curious too. One of the things that drives me bananas about diabetes is that you are never good enough. There is no such thing as perfect. Even if you have, let's go for really bananas. Let's say you have, 100 time in range and you sustain that for a few days. A doctor is going to ask you, like, are you okay? What are you doing to get there? What are you giving up? If you have a low A1C, are you having low blood sugars? Are you having to give up other things to manage your diabetes in that time? If you have a great endo visit, then you're looking ahead to the next one already. Like, well, what do I have to do to stay there? I used to joke when Benny was very little that if a blood sugar came back in range, I wanted the meter to shoot out confetti because there just wasn't any positive reinforcement. Everything about diabetes seemed to be negative to me. It just was never enough. And we had to find ways in my house to fill in those blanks to not make it like a party all the time or rose-colored glasses too much, but to find ways to make things more positive. Because in my opinion, I just don't think there's any positive feedback in diabetes land. Allison, it's kind of a meandering question. And obviously, I'm kind of putting my personal spin on it. Is this something that you talk to people about or that you find is a common thought? Or am I kind of out on a limb here?
No, I don't think so. I mean, one of the things that, as you were talking, I was reflecting on was it's sort of about the questions that I think our healthcare providers ask, because I think I see two things, both in my own experience and people that I work with, that either one, it's never good enough. You're always setting the next goal. When you get the CGM printouts, and I do this to myself, you get the CGM printouts and you're looking for like, okay, where am I out of range and what do I need to fix? And you're not ever really looking at like the times where you are in range and going like, yay, nailed that. Although I'm trying to get better about recognizing like when that's happening for me, but that's like what our brains are trained to go into problem solving mode and to fix whatever's wrong, which can be really emotionally draining because we do put so much effort into doing whatever it is that we're doing. The second thing that I see is a little bit kind of what Sara was alluding to. And I've heard other people talk about this too, where their A1C is meeting targets, right? It's under 7 or whatever goal somebody has set. And a person's going into the doctor's appointment and endo is just going, oh, great job. Keep it up. And you're done and the appointment's over. And so you're not necessarily expected to fix it, but no one's asking about the emotional toll that doing all of that is taking. Like that the idea that the numbers are wholly representative of the experience of living with diabetes is completely blown over, non-existent. It's not even something that anybody is asking about. Your A1C is 5.7. You're meeting targets. How does it feel to have an A1C of 5.7? How are you doing with that? Is there anything else going on? And to really kind of diving into some of those psychosocial components that come along with management and achieving those expectations that our doctors are setting out for us. I think I'm seeing it a little bit more, but I think for a long, long time, it has not been within the purview of the healthcare team to consider that these things that they were asking us to do were going to have an impact on our mental health. And now we're going, yes, it does.
So I've always had I'm in control of my numbers. And I think that I've had a lot of those experiences that Allison has described. And I think to her point, that was a lot of actually what led to a lot of my further mental health struggles with my diagnosis, because it was exactly that. I went in, I pulled my A1C down from like an 11.1 to a 7 to a 5.8. And then it was, okay, great. You have nothing else to learn. I've had type 1 for 6 years now. I've seen one diabetes educator, one single session have I been referred to a diabetes educator. And I actually was begging my doctor at the beginning. First of all, I didn't know what a diabetes educator was until about 1.5 years into my diabetes diagnosis. And then once I finally sat with one, I was pretty much telling her what was going on. And then she said, okay, you're doing great. Have a great day. That was another thing that I think was, again, kind of to Allison's point, we think of, sometimes we get it in our head that it's like, oh, mental health looks this certain way, right? But it's that in and of itself is really difficult when, and I'll use me as an example, I had no clue what I was doing. I knew nobody with diabetes. I was navigating around this New York City with this new diagnosis, walking my dog, not understanding why my blood sugar was dropping all the time because I would like bolus and then go for a long walk. I don't really know. I think I'm just kind of adding on top of, I guess, just kind of seconding what she was saying, where that is really it's a problem and it's a struggle. It's a struggle area. And I think people just don't, the medical providers don't really understand sometimes how that language and that approach sometimes can come off.
Well, Allison and Sara, thank you so much for putting this on. It's such a need in the community. I'm thrilled that you're having it. I'm glad to hear you're already planning more to come in the future. Keep us posted. And thanks for joining me.
Thank you so much for having us.
You're listening to Diabetes Connections with Stacey Sims.
Much more information about Sara, about Allison, and their resources, and of course, about their Mental Health Plus Diabetes Conference that is coming up later this month, and that is all in the show notes and at diabetes-connections.com. I have an update for you on The World's Worst Diabetes Mom, the second book. I'm so excited. But first, Diabetes Connections is brought to you by Dexcom. You know, it's hard to remember what things were like before we started using Dexcom. I haven't forgotten, but I guess what I mean is it is so different now. When Benny was a toddler, he was diagnosed at 2. We were doing something like 10 finger sticks a day. Even when he got older, we did at least 6 to 8 every day, more when he wasn't feeling well or when something was off. But with each iteration of Dexcom, we've done fewer and fewer sticks. The latest generation, the Dexcom G6, eliminates finger sticks for calibration and diabetes treatment decisions. Just thinking about Benny's little worn-out fingertips makes me so glad that Dexcom has helped us come so far. It's an incredible tool, and Benny's fingertips are healthy and smooth, which I never thought would happen when he was in preschool. If your glucose alerts and readings from the G6 do not match symptoms or expectations, use a blood glucose meter to make diabetes treatment decisions. Learn more. Go to diabetes-connections.com and click on the Dexcom logo. First, I have to mention that the session I'm doing for this Mental Health Plus Diabetes Conference, the reason that it's on tape and I won't be doing it live is I have a great excuse. My dad is turning 80 and we are all getting together to celebrate him. So I'm so excited. He's an amazing supporter, just the best. Asks me about the show, listens to the show. Of course, he's much more interested in his grandchildren, which he should be. But it's amazing to me. My dad, my mom too, they've been so supportive my whole career. And if you're listening, Dad, I know you're shocked that I'm talking about you because I never do that. Happy birthday. I'm so glad we're getting to celebrate you later this month. I love you so much. I really am so lucky that my parents, and I'm going to use this as a segue into The World's Worst Diabetes Mom, that my parents are the worst. And they are the worst in what I always mean by that. If you've read the book, they allowed me to make my own mistakes. They allowed me to try things. They allowed me to experience things. They allowed me to take risks. And I'm so excited that the next book is nearing completion. I say excited, I'm also freaking out because my writing deadline is May 31st. So I'm telling you this because we are in the home stretch, but my May is going to be bananas. So if I owe you an email, if I'm not getting back to you, if you want me to call you about something, it's probably not going to happen in May because I'm still putting out 2 podcast episodes every week. Oh my gosh, how am I going to get this done? We're going to do a cover reveal later in the summer. I'm probably going to do a title reveal as soon as I'm done writing. And we'll have some fun with that in the weeks and months to come. You guys have been amazingly supportive. I'm still so thrilled at the response The World's Worst Diabetes Mom got. I won Best New Nonfiction at a national book festival. Oh my gosh. So I don't know if the second one's going to be as good. I shouldn't say that, right? The second one's going to be even better. Where's my publicist? Anyway, we've got some great shows coming up. I'm trying to figure out how to handle all of the news coming out from ATTD. I do have interviews set up already with Dexcom and Beta Bionics. I probably will not put them out any sooner than they are due because of this bonkers schedule I have in May, but I am here to serve you, so I will try to get them out ASAP. If you're not in the Facebook group, please join it. That is where I'm asking for questions. You can weigh in. Give me your questions for all of these tech companies, and I will bring them to the CEOs and the CTOs, and we'll get them asked. All right. Thank you, as always, to my editor, John Buchanan from Audio Editing Solutions. Thank you, as always, for listening. I'm Stacey Sims. I'll see you back here in just a couple of days. Until then, happy birthday, Dad. And you, be kind to yourself.
Diabetes Connections is a production of Stacey Sims Media. All rights reserved, all wrongs avenged.